Nigerian are you? The president was saying in a statement that people who have sacrificed and done great good was concern of defeat from the government and also the mediation as well. But it's time to have conversations. We want to be what's right by president in Nigeria. And what this is coming from day two. I'm now thinking day three, okay. I said on Wednesday, so today is day three. Thank you very much. So why would the headline? I think in 2020. Mid-year, sometime around April, May, June, the association went on strike, and then they promised to end strike. Other fact, in 2021, the then president had said, and we don't hear that 40% were in progress. In 2022, which was here, was the one I can't remember now. I know the strike. I'll show it to him. But yes, what I should do is they have some of them clean, and they have to now move right. This time one strike. Are demands the same with the strikes of yesteryears, or do we have new issues that we're tackling? Let's start from there.
Okay, thank you very much for inviting us, inviting me especially to your studios. I really appreciate it.
Okay.
And it's also a good platform to educate Nigerians on some of these perennial issues. There are plethora of reasons why we embarked on this current strike, and it's unlike what you said earlier. Some of those points that you mentioned in 2020, 2021, some of them are recurrent.
Recurrent?
Yes.
Okay.
Why did I say so? There is issue of medical residency training funding, which is supposed to be yearly.
Oh, okay. Just list them, and I ask you one by one. Okay.
There is issue of 2014, 2015, 2016 salary arrears that have not been paid till now. There is issue of recruitment of staff in the federal system, because there is an embargo on employment. At certain points, there are a lot of bureaucratic bottleneck for a chief medical director to replace the staff. It takes about 3 to 6 months. So currently, our demand is they should give them the authority to replace staff when they leave. We are crying about brain drain currently because doctors are leaving, other health workers are leaving. So you should give these chief medical directors an opportunity or a platform to short circuit the bureaucratic bottlenecks that they face in trying to replace their staff. One of the other reasons includes the issue of bill sponsored by Honorable Gani Johnson, which is also something recent. It's an ill-conceived bill. It's obnoxious as well as reprehensive, and it's against the Constitution of the Federal Republic of Nigeria.
But Dr. Chris Ngige has said that the federal government has kicked against the bill.
Yes, that's after the Federal Executive Council meeting on Wednesday. He came out on air to say that the federal government have kicked against the bill, because that bill, like we said, the Ministry of Health, which is the parent ministry for the doctors, didn't come out openly to reject the bill. It's the Ministry of Labour that did. So we are looking at it like it's a group of people sponsoring that bill from the Ministry of Health. So why not the Ministry of Health come out to kick against the bill? Why the Ministry of Labour? But that being said, the bill is they didn't consult stakeholders before going out to project such kind of bill in the House.
All right. So when I talked about the strike being annual, you were shaking your head. So I have a report, an article that in 2022, your president at the national level had given a 2 weeks ultimatum.
Yes.
And you guys were going to go on strike. So that was like a warning, right? Yeah.
Oh, we didn't go on strike.
You didn't go on strike, and that's what I wanted to do. I want to correct that one now. That being said, so maybe a lot of Nigerians don't know the role you play. Who is a resident doctor? Can you explain to Nigerians who a resident doctor is?
Okay, thank you very much for that question. It's important to also educate the public. A resident doctor, in the medical training, when a doctor graduates from the medical school, you start do your 1 year housemanship, the internship training. You now proceed to do your NYSC. When you come back from NYSC and you write the requisite exams, which we call the primaries, there are two colleges. They have the West African College and the National Postgraduate Medical College. So you determine the college. You can have both college exam certificates. So when you have that requisite certificate of primaries, you can now be admitted into the residency training. So when you are taken in a teaching hospital setting, you are now a resident doctor. So your training is to become a specialist. to become a consultant. And there are different subspecialties in which you want to train. So you determine which area you want to go. Is it medicine, surgery, pediatrics, internal medicine, pathology, radiology, ophthalmology? So you neurosurgery, whatever area you want to go to. So you take that exam in those areas and then to specialize. So in these the doctors that are undergoing training to become specialists are referred to as resident doctors. That is why it is in a teaching hospital setting. So it is a teaching hospital.
It has to be in a teaching hospital.
It's a teaching hospital.
It's compulsory.
Yes, the teaching hospital. However, there are some private hospitals that have the status of a teaching hospital.
Okay.
Because they have the manpower and they have the accreditation from the colleges to train doctors in certain specialties.
Okay.
So if you want to do certain postings, you might go to those hospitals to do the postings because it's accredited.
So is it because it must be in a teaching hospital that is why the government has to pay the, what did you call it, the resident doctors? There's a fee you called?
Is the medical residency training allowance?
Yeah.
Is a kind of allowance for the exams that you take during in course of training. There are steps. You go for update course. 2, you go for exams in either of the colleges. You go for ethics course. You go for research, and you do a lot of other activities, publications. So it's more like a special funding for all these programs that you're going to embark on in the
so the government is funding these programs for the doctors undergoing training.
Yes. So those programs are sponsored by the government.
So what's the problem now? The problem is that the government does not give the money for the programs, or the money given is not enough. What's the problem? It's like a bursary. Correct me if I'm wrong.
It's not like the bursary. However, because there are specific things it covers for, like I mentioned. You're paying for research, you're paying for the exams, you're paying for some of the other exigencies, the ethical courses that you need to attend in course of your training.
Okay.
Yeah. That is not to say that everything is paid for. Take for instance myself being here. I'm a cardiothoracic surgeon in training, and then there's no accredited cardiac center in Nigeria. I'll have to leave the country to maybe India, wherever, to go and undertake my training within this period. So you see that the medical necessity training funding does not cover for your training. You have to pay a lot of money out of pocket. So it's more like a subsidy in course of the training that they are just trying to subsidize your fees for the exams.
Interesting. So what other problem did you complain about?
The other problem I complained about is we also have the issue of review of COMMES, Consolidated Medical Salary Structure. If you recall, the federal government paid peculiar allowance to other civil servants. And that was 40%. The doctors and the Ministry of Health, especially, there was no such payment because they say they are reviewing the salary structure for those in the health sector. Yeah,
they said so.
Doctors not exclusive, because there's also the Consolidated Medical Salary Structure that is that for other health workers in Johesu. So this have not been done, and then there are a lot of back and forth in course of this negotiation, and then the government proposed a sum of 25%. While they give other civil servants 40%. Looking at NARD, Nigerian Association of Resident Doctors, has a research and statistics committee, and from all the inquiries and the research and everything that was done, it came up to about 257%. And NARD is demanding that if something must give way, considering the inflation rates, considering the removal of fuel subsidy, as well as the salary structure itself that was initially proposed came into being in 2009 and was implemented in 2014. And in that proposal of the salary structure in 2009, it was said that was supposed to be reviewed every 5 years. 2014, you put it into effect. What is this? What is today? This is 2023. That's about 9-10 years. So we are now saying that, considering that you are going to review this salary structure every 5 years, it means you are supposed to have reviewed it twice by 2023.
But there was some kind of reviews. Some, was it last year? Was it in 2021 that had to do with hazard allowance and some other money paid to the doctors and the resident doctors?
There was a lot of outcry That's why you had it. And then I don't even want to talk about the hazard allowance because it's a far cry from what we actually demanded for. But they just generalized it and paid everybody whatever they wanted. So the hazard allowance is just if one of the allowances that we were entitled to, and they just reviewed that one upwards, and then from 5,000 to about 30, 35 to 40,000 hazard allowance. So considering that there is also the issue that, like I mentioned, the issue of consolidated salary structure, the issue of replacement of staff, like I've also mentioned earlier, because of the time taking and the bill that's being sponsored by Honorable Gani Johnson. Similarly, we have the issue of the same problems plaguing the state-owned institutions. Some states are owing their staff as much as 21 months' salary, like Abia State. And then if you look at the country, you see that there is an internal brain drain. If I'm working for Abia State government and my counterparts in the federal institution are earning 20,000 and I've not been paid my 20,000 naira for 21 months, what do you think I will do? I'll move to the federal institution. So is that not an internal brain drain? So you are discouraging people to work for the state government because the state governments are not paying attention to health. And then there has to be a playing ground that the federal system makes the rule, and then everybody adopts their template that is workable for them. So we also brought it to the fore because in the Abuja Declaration in 2001, it was stated that the minimum that is acceptable for the health budget is 15%. And then what do we have for 2023 budget? 5.7%, which is...
But you know, some would argue that there is no sector really that gets, education is supposed to be more, but look at what it gets, right? Health is supposed to be more, look at what it gets. Military, which is security, is supposed to be more, but look at what it gets. That's from the budget, right? But then some would also argue that it looks like the government is doing you a favor when they give you this special allowance, like you call it, or this special funding for programs, like you call it. Would you doctors, especially the resident doctors, agree with that?
See, I don't agree because in the hospital setting, you are working, you are rendering services because there are different pathways for doctors. You can decide to after graduation, decide to practice on your own, you become a general practitioner. As in, you're not working for the government, you maybe own a private hospital, you become a general practitioner. So you are not in this specialty to specialize. There are other groups of doctors that are maybe in the university as lecturers. They teach medical related courses.
So, but they don't have a specialty.
They don't have a specialty per se unless they do their masters and PhD in certain areas. So that makes them professionals in those areas, but they are not specialists. So they are not in the training. So, like I said, they have these pathways. For the residency training itself, the program, when you look at it, the exam fees keep going upwards every day. So it's more like a way to subsidize the cost for the training. It's done everywhere.
It's done everywhere, all over the world.
Yeah.
Oh, okay.
It's
interesting.
done everywhere.
Okay. So there's a break coming up, a commercial break, and I'm looking at the time. I have one more question for you. But I'll just ask you so that when we go for that break, you think about it, and when we come back, you answer. The federal government, maybe they're thinking, like you've agreed to, there is a brain drain internally and externally.
Yeah.
The federal government say, okay, what if we train these guys and they become specialists? They then leave for countries who are looking for doctors with specialties and all of that. Why should we give them all of what they are demanding? Could that be a reason? Think about that when we come back from the commercial break.
Right.
I would throw that question to you, and very shortly you listening can also call in and ask your questions, because we're looking at how this will affect the common man, the patients who are in need of medical help. All right, stay tuned once again. If you are just joining us, you're listening to Hard Facts on 92.3 Nigeria Info. I am Kalada, and I have Dr. Onuah with me in the studio. He is the president, Association of Resident Doctors, UPTH, University of Port Harcourt Teaching Hospital. And we've been talking about the warning strike and backed upon by the National Association of Resident Doctors. Nigerian Association. I keep saying national. Thank you for the correction. Nigerian Association of Resident Doctors. And I just did the calculation. I was saying that they went on strike last year, but he said no. But since 2013, the association has gone on strike for about 159 days. So that's almost about half a year since the association. Yes, since I know you want to say since 2013, but I mean strike is strike, right? And in each of those times that you guys have gone on strike, the people have been the ones to suffer for it, right? And then the government, I can argue, my opinion, that the government is paying these special funds with the taxpayers' money, because it's not the money of the government. So then you would have to also consider the taxpayer when you're embarking on the strikes. But then I'm reminded that in 2021, the president of the association did say that 40% of the demands made then had been met. And now you're saying some of these demands are recurrent. As the government, in this ones that you guys are striking for or protesting for, has the government ever made any attempts to pacify or meet these demands?
Okay, I would like to say that this strike was preventable. Prior to this time, when the ultimatum was issued in Abeokuta following our emergency National Executive Council meeting, an ultimatum was given and the meeting was called. The week of the meeting, the meeting was just cancelled. So it was like a neglect to what the National Executive Council could do. So we had another emergency meeting and we decided to embark on a warning strike. As we speak, there's an ongoing negotiation.
So what happens after the strike?
We have an ordinary general meeting in Lagos University Teaching Hospital.
Okay.
By the end of this month.
All right. I'll go for another quick break. It's time for the news, the headline news. After the headline news, I'll come back and I'll take phone calls and I have more questions for the guests in the studio. Stay tuned.
Headline news, Nigeria Info on 90.
doctor to 10,000 patients in Nigeria, what do you think is going to happen? The resident doctors are the largest workforce in Nigeria because of the number of doctors in the training. And considering that, you also have to know that the hospitals are supposed to be well equipped. You have to have more manpower and staff in the hospital. Patient comes to the hospital, they spend a long time, hour waiting time. And we are saying give the chief medical directors the authority to replace the people that are leaving. So the essence of this strike is for the patients, if you look at it. So they are not just issues that have to do with payment and remuneration. Like you pointed out that the doctors moving to other countries. I want to also tell you that there is brain drain in the UK. The doctors in the UK are moving to the US, are moving to Australia, they're moving to Canada. So it's not just Nigeria that is having brain drain. That is why they are taking Nigerian doctors, because the doctors, their own doctors, are leaving the United Kingdom. So there are push and pull factors. There are things that will make you stay. Job satisfaction is another thing. I've had 2 weeks ago, a patient came to children emergency. The patient did not have 1 naira. The pediatricians had to contribute money to buy chest tube for us to even do the procedure for the patient. And we have lots and lots of such patients. A patient in the hospital didn't have money for surgery. We just had to inform the chief medical director. He gave a waiver, wrote on the folder that this patient should get treatment. How many of such is the hospital going to sustain? Do you understand? So there's the current cost of running the hospital, and then there are some of these things. The only thing you can get is maybe if they have NGOs and some churches coming to the hospital to make certain payments for some people. But the funding of the hospital is pertinent. A healthy nation is a wealthy nation. In the Saudi Arabia, some of our colleagues have moved to Saudi. In fact, they tell me that some patients come to the clinic just to come and check their BP, and at the middle of the night, they wake up at night by 2 a.m. and they come to the hospital and say they want to check their BP and go back home, because their health system is fully funded by the government. They don't pay anything out of pocket. So when you are paying out of pocket, it becomes very difficult.
Okay, so when you talk about payment from pocket or out of pocket, you're making reference to an insurance scheme, so to say.
Yeah.
I remember one time the NHIS was, am I correct, the National Health Insurance Scheme?
Yes, it has moved to NHIA, National Health Insurance Authority.
Okay.
Currently.
So what is that about? What is that effective? Is it working? Is it functional?
To some extent. But not everybody has subscribed to this National Health Insurance Scheme.
Why? What's the challenge? What's the bottleneck?
Do you have health insurance?
Yes, I do.
Because of where you work?
No, I think I've always, because of how I grew, I've always known about insurance.
How many Nigerians have health insurance? By the time you go to the outpatient clinic, you know that a lot of people does not have health insurance. Most of the people that have health insurance are people that work for government. The private individuals, private sectors, especially multinationals, yes, they have their insurance scheme. But most individuals, businessmen, don't have health insurance.
Interesting.
And it becomes a serious issue when the person gets to need care. So all these things culminates to a bad health system. So the government has to step up in funding the health sector.
Okay, so the question I wanted to ask you before the break was, why should we train the doctors when, like you said, there are usually things that pull people away, lucrative things? You said in the UK, some of the doctors from there have moved to other places for, what we call greener pastures. So what is the guarantee that when we train, we improve the standards, we give you the residency training fee, and then we give you all the things you're asking for, that you would want to stay in Nigeria and not go to the other countries that seemingly look better?
The thing is, you have to know that there is no guarantee that if you don't develop your health system, the job satisfaction will make people to continually leave your system. That also brings you to the fact that you saying you are training the person, you are rendering service. Me being in a teaching hospital, I'm there and I'm working. In fact, my subspecialty, I'm on call every day. So what do you think is going to happen to me? Burnout. Because I'm on call every day. Come here at any hour. I'm supposed to be in the hospital. I'm supposed to attend to the patient, and I do that on daily basis. So we need people. You can't continue working like this. There are a lot of people that are looking for employment into the teaching hospital setting. to come and undergo the training, and then you are preventing people from leaving. This exodus of doctors was as a result of the fact that people post-graduation could not even get a placement. So we still have a lot of doctors in the country. If you recall, you remember that the Minister for Labour also said that at a point, as that should be last year or so,
about 2 years ago,
that want to be employed, but they are unemployed.
3 years
so
ago.
if you look at it, why stop people from leaving? It's against the constitution of
but you see, it's not stopping. It's like you said, a lot of people have not been able to go through the training. Then the little set or the minute few who have been able to go through the training and now leaving with that specialty. The question, and I'm not in support of anybody, I'm just asking a question, because when you want to look at that bill that emanated from the National Assembly that says you must do 5 years, it's just saying a lot of you are leaving with your specialty and leaving, the people who are just starting to run Dennis. What is the guarantee that you would stay and after being trained, given that special allowance, help develop the health system that you're complaining about?
I want to ask a question. If I train you on broadcasting and you come to your studio, you do not have a microphone, what is going to happen to your training?
I'll go somewhere else where they have a microphone.
Good. Or you remain here and you become useless.
Okay.
You in fact, you have diminishing return. All the trainings you've gotten over the years, you lose them. You lose your skills.
But then, did I think about the fact that there was no microphone when I was going through the training?
Of course, there's no microphone. That's why you went to another country to train, thinking your government within this period is going to.
Okay, I get
bring
you.
A microphone for
I get you now. I get you now. So what can you do for the patients who are seeking medical help during your time of strike?
In the teaching hospital, the consultants are working.
Okay.
However, even on a normal day, the patient load is so much with the resident doctors on ground, so they can only offer skeletal services. That's the only thing they can do. And some other hospitals are open, but the teaching hospital is not open. We apologize and appeal to our patients to bear with us. It's not easy. Some of us are patients. Some of us also have relatives that are sick and in the hospital. But we are not lovers of strike. But then at a certain point in time, even when you push the bull to the wall, he has to react. I
understand you have to demand these things, but how do you reconcile this with the Hippocratic Oath that, says saving life must come first?
Kalada, I would tell you to go and read the Hippocratic Oath.
I'm not a doctor. I only ask a question.
The recent Hippocratic Oath states that you must take care of your health first.
So you first.
You must.
So no. Just say you first.
If you don't take care of yourself, then you cannot render help.
So that's what I'm saying. In summary, you first. You as a doctor, yourself first.
Your doctor have to be healthy. A healthy doctor is a healthy patient.
So that means, okay, I get it. All right, it's time for you to join the conversation. Like I have said, how do we help them make the demands at the same time not allow patients suffer? Is that possible? They have been making demands, like I've just read out, since 2013. A total of 159 days by the end of this 5-day warning strike. How do we help our doctors? We don't want them to leave, remember, because we want as many specialists as possible. So because it will still affect you. If all our specialists leave, when you have a special situation, you would have to travel abroad for medical help. So we want them to stay. But how do we satisfy our doctors, especially this time of strike, and also not allow our patients suffer? Because you see some people who are suffering from one medical issue or another, they are in severe pains. You might have a relative, you might have a friend, so you know what I'm talking about. So I'm going to open the phone lines right about now. 0817 923 0002. 0817 923 0003. WhatsApp and text messages to the number 0809 030 6416. Begin to send in your contributions. We're live on Facebook, Nigeria Info PH, and on Twitter, Nigeria Info PH. And there's another question for you. How do you think we can stop this continuous strike? I know usually when we talk about strike, we are reminded of ASU, but even in the health sector, we've had a series of strike. If it's not JISU, it's NARD. If it's not NARD, there's this other one I'm trying to remember. But you get the point. But, how do we ensure that a strike is a thing of the past? It's not like Nigeria is the only place where they strike. I mean, in the UK, I think some health workers were striking a few months ago. But how do we ensure? I mean, we can, right? How do we ensure that strike is not a regular event, especially in the health sector? Because health, they say, is wealth. The doctor said it, not me. Chibuzo is calling from Port Harcourt. Chibuzo, let's hear you.
From my 7.
Oh, you're calling from my 3?
Yeah. Yes.
The line is noisy. Can I? Okay, you know what? Chibuzo, please to call us back. I'll take this one. Oh my goodness. Hello.
Yeah, good evening.
Yeah, good evening. What's your name?
Yeah, good evening. I'm Ida from Nkoro.
All right, Honorable Ida, welcome.
Please, I'm pleading with the doctors not to go for strike. But, Kalada, if you never been to hospital, because at the hospital, something is happening there. I'm pleading with them.
What's happening there?
They should appoint one person for that to go and meet federal government, so they will be talking where they are doing their work. Or for them going for strike, people are dying. Please, ensure the masses. And I'm pleading with federal government, whatever thing the doctors need, they should give to them. And when then they are sick, they will travel out of the country, go and treat themselves and come. Malaria, they are traveling out. Then tackle something that is in your country or your state, you cannot do it. Please look at the teaching hospitals, check the environment. See, there's one to make sure they put up that environment very, very well. Mosquito there is much.
Okay.
And now you're coming to treat somebody, you're getting malaria, so you go and treat yourself. They should please do something good to Nigerians. We have the money, we have the resources. Let us use it for ourselves. Thank you very much. God bless you.
All right, thank you very much, Honorable Ida there. Thank you for your time. Let's take this one.
My name is Brownson.
Brownson, welcome.
Oh, I'm actually calling from Sansamade here in Port Harcourt.
All right, Brownson, welcome. Let's hear you.
Yeah, I want to greet your guest in the studio.
Thank
Dr.
you, Mr.
Arthur, well
Brownson.
done.
Thank you.
You see, my brother, the leaders of the Nigerian
please
state.
turn off your radio set. Thank you very much. We don't have to hear the echo.
The leaders of the Nigerian state really don't have the interest of health at heart. Most of these issues that they are talking about has been a long agreement. I take, for instance, during the time of COVID, we expected that the leaders of this country was going to sit up to set back the health system of this state. But like the last caller said, malaria and every little issues, the leaders are traveling, leaving this country and not having your own interest and my interest at heart. The doctors are human beings. They didn't fall from heaven without having relatives and friends. They have people that need medical help. But like he rightly told you, when you are pushed to the wall, there is an extent to which we say, this is painful, this is enough. So I'm appealing to the public to join us and talk to the leaders of this country to take issues concerning health very serious. Thank you very much, my brother.
Are you a doctor? You sound like a doctor.
By God's grace, I am one. And I know what I'm, in fact, not just a doctor, but I'm involved in preventing death related to deliveries, maternal death.
Okay.
A lot of women, I'm a gynecologist.
Okay.
And I know what women are passing through. We know how we run helter-skelter to save the lives of some women that don't even have a dime. As compared to other countries where a lot of things are on ground to save the lives of these innocent women and their unborn child. But most times we suffer a whole lot of things because we are in a system where things are not properly put in place.
All right. All right. Thank you for your time. Thank you very much. I've got Jerry calling from Ozwaba. Jerry, welcome.
Yes, Canada. Good evening.
Yeah, good evening to you.
Yes, I've been listening to what your guests have been talking about in the last few minutes. Well, fortunately enough, I just have a patient who just got discharged from UPTH. And the condition, the environment wasn't too good, but that's secondary. Concerning their strike, for me, this is just an clear show of the government's inability or backwardness when it comes to health in the country. When it comes to health, with like your guest scientist said, a healthy doctor is a healthy patient. And if you don't provide the necessary items for the good condition of that doctor, then you're trying to tell the populace that you don't mean well for them. Okay. They have been yearning for good and better working conditions for 10 years now, and the government is unable. Not that they don't have the willpower to do so, but would I say out of sheer ignorance, they refuse to do so. So let's all, well, for me, I'm not condemning the strike action, but it shouldn't stay for long. Because if measures like this are not taken, then definitely there will be a problem. The government will not even answer them. Sometimes you may ask me, the ones that they have taken so far, where are the results? But I think results will certainly emanate from now.
All right then. All right.
Yeah.
2 questions for you because we're almost out of time.
Okay.
First one is about 2-3 callers have called in and said the mosquitoes in UPTH is mosquitoing, so to say. Allow me to use that word. So what is it with that?
You know, the UPTH environment is a swampy area.
Okay.
And the way that place was built, there's water underground. So it's more like a breeding site for the mosquitoes. I can assure you, if you go to the hospital now, when there is few patients in the ward, you will not see those magnitude of mosquitoes you used to meet. As the patients come back, the mosquitoes will come back.
What's the science behind that one?
I don't know. But
so
then,
is there anything you guys can do to reduce the...
there has been regular fumigation, but it's very difficult to control. I must confess, it's difficult to control. However, in a developed country, there are ways you can make those mosquitoes sterile. So it's all about funding. It's all about...
When you say make it sterile, it does not transmit malaria?
Yes.
Oh, okay. Interesting. I learned something new today. The second question I want to ask is, what are the demands that are immediate, pressing, that if the government should handle them now, the doctors would be, let's say, 50% satisfied?
You know, one thing is, when you look at the strike holistically, why our strikes doesn't last so long is because we also consider our patients. If certain things are put in place, we just call off the strike and give the government an opportunity to respond to our demands. But you know, as soon as you call off the strike, if to attend to Israel, nothing is going to happen anymore. So that's why we have to always put certain minimum demands. However, this strike, like I said, also was preventable, but the government called for a meeting and cancelled the meeting.
All
so
right.
it was more like, what can you do?
Do what you can.
Do what you can. So
right.
That was what necessitated this strike. Because initially they were advocating for an indefinite strike, but because we had to put Nigerians into consideration and say, oh, okay, let's have a 5-day warning strike so we can go back to work and attend to our patients.
All right. And then I asked you, after the warning strike, what next? After your meeting, you said a meeting. I
told you there is an ongoing negotiation, didn't I say so?
Yeah.
I've said so.
But what if they don't meet your demand? That's what we're painting that picture.
Why are you taking the negative part?
I'm a Nigerian.
You have to be on Nigerian.
My president said I should be on Nigerian. You listen.
So I believe that something fruitful, meaningful will come out from the negotiations.
Okay.
So we hope that the government is going to respond. There's also going to be another meeting with the Ministry of Labour. The National Assembly, there's only an ongoing meeting. There's also going to be another meeting with the Ministry of Labour. So I believe that in a short while, the demands are going to be met. However, if the demands are not met, we are going to deliberate on whatever the outcome of these meetings are by the end of the month.
Can you preempt that deliberation?
I cannot. I'm just the center president. We have over 53 centers. And
you guys sometimes think alike. So what do you think?
I cannot think for everybody. Do you know what I wanted? An indefinite strike. But what we have is 5-day warning strike.
Okay.
Because we want Nigerians to go back to their normal life.
All right, then. Thank you very much for coming in. Thank you. That's the much that we can take. And if you're just joining us, you can still contribute by the time we open the mic. That's the open season. I've been talking with the President, Association of Resident Doctors, UPTH, and we asked the questions: how can doctors get their demands without the patients paying the cost? And my guest has been Dr. Ato Onuah. Thank you very much for listening. Stay tuned.
Nigeria Info will be right back.
Welcome to Timipa Montessori School.
I know I can be what I want to be.
For your children's quality education at crèche, nursery,